Appendicitis is very common in children between age of 6 to 16, and this is an infection of an organ called as appendix. Appendix is a finger-shaped organ which is joined to our large intestine. Weirdly, there is no role that it plays, but an infection to this organ can be fatal. And this is called as appendicitis, and the surgery done is called as appendectomy. In case it is not done on time, by watching the symptoms, as I said, it can be fatal. So in this video we are talking about symptoms and what are the treatment that can be given when a child suffers from appendicitis. Hello and welcome to Tots and Moms. My name is Kavitha Prashanth. We'll start with talking about the symptoms of appendicitis. Severe abdominal pain. My cousin who suffered from appendicitis, both brother and sisters got operated, and they told me that they had severe stomach ache, abdominal around the belly, that they were not able to sit, neither stand, because it was crunching them down, and it is that severe. They in general, kids can also complain about vomiting, elevated heart rate, loss of appetite. These are certain things that you can observe. Kids with cystic fibrosis or family history are at a higher risk, so please monitor them. We are now talking about diagnosis and treatment of appendicitis. At first, when your child complains, please rush immediately. The symptoms can be common to normal stomach ache, but this is severe. So talk to your child and understand, get them to doctor. Doctors will check their vital initially, their heart rate and BP. And if they find anything that needs immediate attention, then they will ask for a blood test or urine test to check if there is an infection. They shall definitely ask for ultrasound scan, X-ray scan, MRI or CT scan as well to confirm this. And if confirmed, a minor surgery called appendectomy needs to be immediately done, and there is no reason that you hesitate about it, because it is a minor surgery. In 1 or 2 days your child would be discharged. In 4 or 6 days he'll be able to come back to his routine life. And in case delayed, unfortunately, if the appendix ruptures or bursts, then the infection will spread to the abdominal cavity. There is a high chance of infection and other things that can definitely harm the child. So what doctors do is they delay the surgery. First they will focus on removing the infection. 10 to 14 days under observation the child is taken care of, and then once the child is settled, after 6 to 8 weeks appendectomy is performed. The duration that a child who's operated on time stays at the hospital is lesser than the duration of a child who had a ruptured appendix. And if things go in his favor, he will be fine. But if the infection spreads too quickly, this can be fatal. So please never neglect any symptoms as such. Take and talk to the doctor. And I really hope that this basic information that I have given you would find helpful, and comment and let me know if you have any basic query related to this. Doctors are the best judge. This knowledge can help you understand what is this infection and how to take care of it, but they are the ones who will recommend the necessary. So please do not consider videos or any Google information as an alternate to doctor's advice any day. And on this channel I regularly make videos like these, which are necessary for kids care, baby care. I also post kids food recipes, baby food recipes. Go and check the playlist. Today I have 2 video recommendation. Please watch the video about pneumonia, symptoms and care. I have also made a video on jaundice. So please check that as well, neonatal jaundice. So if you know what the disease is, what the symptoms are, the treatment can be immediate, and child not suffering much can be taken care of. And by the name Tots and Moms, I run an organic food store. Our products are well sold on Amazon, Flipkart and First Cry. Consider checking them out on our store, shop.totsandmoms.com. Also you can find them. For babies, cereal, porridge mixes, instant mixes like sprouted ragi powder, and Kerala banana powder, dry fruit powder you can find. And for older ones you can find pancake mixes, cookies and drink mixes, all made with healthy ingredients, millets and jaggery only. We do not use sugar here, and our products are USDA organic and FSI certified. Do consider checking them. Any queries you can post down in the comment section, and I'll see you soon. Please consider clicking on that subscribe button or follow button, and bye bye.